Hi, Mrs. J. This is
Hi.
Miss Josie. How are you? How are you, coders? Welcome to Tuesday night group study, and we're going to go over the steps to solve a CPC exam. Please welcome Mr. Sandeep. Come on out and say hello, Mr. Sandeep.
Hello, good evening, coders. Good evening, Miss J. Good evening, Miss Josie, Miss Courtney, Miss Jolly, Miss Carla, Miss Vivian, and Miss Eva. I think I named them all. I didn't miss anyone. So welcome back to the second session of group study classes. All I have to say is buckle up, coders. Today we are having some good scenarios for you, and I'll be coming back to take some of them. So see you in the chats.
Thank you, Mr. Sandeep. And Miss Eva.
Hi, coders. Good evening. How are you guys? How was your week? I hope you're doing awesome and hope you're excited as I am to do some honest. What is it? Just coding. Just code, coders. You're doing great.
Thank you, Miss Eva. And I'm Miss Josie, your co-lead. And I'm excited that you're here because we're going to learn a lot about breaking down these case scenarios for the respiratory system and cardio. This is exciting. Are you ready? I'm going to bring out Mrs. J.
Hey, hi everyone. It is so good to see everyone. We have a fantastic group tonight. There's a lot of you here tonight, so I'm excited. It is a beautiful evening where I am. I'm in Pittsburgh, Pennsylvania. Where are you? Go ahead, type in the chat. Let me know that you can hear me. How does my sound? How is my sound? How is my sound? Does
You
my
sound
mic?
good, Mrs. J.
Okay, I wanted to sing. Awesome. Thank you so much. Does my mic sound nice? Good. All right, take it away, Miss Josie, and introduce our amazing interns.
All right. I'm excited to announce these fabulous interns that are working hard behind the scenes. Miss Carla, coming out and say hello.
Hello, team. Hello, Mrs. J. Hello, Miss Eva. Hello, Miss Vivian and Mr. Sandeep and the rest of the A team. Welcome, coders. I'm glad you're here. Hope you all are having a great week so far. So let's get it. Let's code, coders.
All right, Miss Carla. Thank you for being here tonight. Miss Courtney, come on out and say hello.
Good evening, coders. We're excited for you to be here with another awesome group study. We've got a lot of great scenarios, so let's get to coding.
We're off to a great start with Miss Courtney. Miss Vivian.
Good evening, coders. I hope you have an awesome study group today. I think we'll learn a lot today with our awesome instructors. So let's have fun.
Thank you for being here, Miss Vivian. And Miss Dolly, come out and say hello to the coders.
Hi team, hi coders. I'm excited to dig into some scenarios with you guys and I'll see you in the chat.
Yes, I think it'll be a lot of fun. Miss Anu, come on and say hello.
Hi everyone. Good evening all. I'm very glad to be here. Let's see you all in the chat.
Yes, we're all ready to get started. We're going to turn it over to Mrs. J.
All righty, thank you so much. And welcome, welcome, welcome. We have we have some amazing interns, some great voices. I love it. I love it. I love it. All right, goals of the presentation tonight. We're going to review one respiratory scenario. We didn't get a chance to get to it last week. We're going to get it done tonight. Cardiovascular scenarios, digestive system, urinary mail system scenarios. And before we get started, let's review how to solve a multiple choice case study scenario for the board exam. Typically, these will be operative reports. First things that you need to do, highlight your key terms. Remember our key, yellow for diagnoses, green for procedures, and pink if it's inclusive or bundled. Number 2, document your inventory, your procedures, diagnoses, and select the primary. Number 3, review guidelines. And 4, select the code that best matches your inventory list. All right. Since we've been doing this, we've been noticing that when you're highlighting, there are some things that you don't have to highlight. You just don't, because you're never going to code them. Number 1, things observed by the physician. Number 2, closures such as sutures and staples, etc., for non-integumentary. I have to stipulate that, because if it's an integumentary procedure, you're often going to have to code the sutures or the closures. However, who has a huge operative report for integumentary? I'm talking about like repairs, honestly, and lesions. All right, number 3, hemostasis, such as bleed control, drains, irrigation of the surgical site, installation and removal of clamps and or trocars, dressings, surgical risks.
I would like to invite Miss Eva to read out this scenario. Miss Eva, would you like to read this scenario for me?
Sure thing. Let's start, coders. What are the CPT and ICD-10-CM codes reported? A. 44204 K63.5, B. 44205 K63.5, C. 44202 44203 K63.5, D. 44206 K63.5. Preoperative diagnosis, right-sided colonic polyps. Post-operative diagnosis, the same. Procedure, laparoscopic right hemicolectomy with ileocolic anastomosis. Description of procedure. After induction of adequate general endotracheal anesthesia, the patient was carefully positioned in the supine modified lithotomy position and Allen stirrups. Great care was taken to carefully pad and protect all areas of potentially bodily injury. The abdomen was prepped and draped in the usual sterile manner. Using a supraumbilical vertical incision, a hands-on technique was employed to carefully place a 10 mm cannula. Carbon dioxide pneumoperitoneum of 15 millimeters Hg was achieved, after which a 30-degree telescope was carefully introduced. Under direct vision, 2 left-sided ports were placed, one in the left lower quadrant, one in the left upper quadrant, each lateral to the epigastric vessels through horizontal stab wounds, with a combination of head up, head down, and right side up. The entire right column was mobilized from the duodenum, pancreas, and right uterus using 10 mm diameter Babcock grasping forceps and 5 mm diameter harmonic scalpel. After complete mobilization and copious irrigation and verification of meticulous hemostasis, the supraumbilical port was lengthened to 4 centimeters, through which an Alexis wound protector was placed. The entire right column was withdrawn. High ligation of the ileocolic arcade and the right branch of the middle colic were undertaken using 10 mm diameter ligature atlas. The atlas was used for the remaining mesentery. The bowel was circumferentially clear of fat proximally and distally, and each end was divided with a GIA 100 mm stapler with a blue cartridge. The field was draped with blue towels, and the antimesenteric border of each staple line was excised along with the terminal ileum. A side-to-side functional end-to-end anastomosis was fashioned between the remaining ileum and column limb, with a GIA 100 mm stapling device with a blue cartridge. The staple line was verified for hemostasis, after which the efferent limb was secured to the efferent limb with 3 OPDS to seromuscular Lambert type sutures. After verification of anastomotic hemostasis, the apical enterotomy was also secured with a GIA 100 millimeter stapling device with a blue cartridge. The anastomosis was healthy, pink, widely patterned, circumferentially intact, and easily returned into the peritoneal cavity. After copious irrigation and verification of meticulous hemostasis, the fascia was closed with interrupted number 1 Vicroplus figure of 8 sutures. The subcutaneous layers were irrigated with meticulous hemostasis was verified. Port sites were closed in a similar manner. The skin was closed and covered by dry dressings, and the patient was discharged to the recovery room in stable condition without having suffered any apparent operative complications. What are the CPT and ICD-10 CM codes reported? Coders, you have 2.5 minutes. Coders, time is up. Please put your answers in the chat if you haven't done so. They're ready, Mr. Sandeep.
Thank you, Miss Eva. Thank you. Thanks a lot for reading that scenario. So code is at time, and I can see some of them saying B, and I can see a split between A and B actually. A few C's. Okay, let's go ahead and solve this scenario. The first step is highlighting the keywords. So in this scenario, you can see the post-operative and pre-operative diagnosis are the same, that is right-sided colonic polyps. And the procedure performed is a laparoscopic right hemicolectomy with ileocolic anastomosis. A general endotracheal anesthesia was given and the patient was placed in the supine position. Supraumbilical vertical incisions was made to insert a 10 mm cannula. And a telescope was used, which let us know it's a laparoscopic procedure performed. The right colon was mobilized using 10 mm diameter Babcock grasping forceps and a 5 mm harmonic scalpel. The entire right colon was withdrawn. The bowel was cleared of fat proximally and distally, and each end was divided with a GIA 100 mm stapler. and was excised along with the terminal ileum. So in the last two lines, you can see that the major portion of our procedure was performed. You can see the colon was removed, and it was removed along with the terminal ileum. And in the next line, you can see a functional end-to-end anastomosis is also achieved between the remaining ileum and the colon. And finally, the apical enterectomy was also secured. So the correct answer for this scenario is option B. Yes, I can say, I know there is questions. There will be questions on this. Okay, let's move on and look how we arrived into the answer. Coming to the next step, let's have our procedure inventory as well as a diagnosis inventory. In the procedure inventory, we are having a laparoscopic surgery, right hemicolectomy, excision of a terminal ileum, and finally an ileocholic anastomosis which is achieved. And in the diagnosis inventory, we are having only one diagnosis, that will be right-sided colonic polyps. And these are our code options. Now let's begin the process of elimination. Let's look into option C, 44202, 44203, K63.5. So easily first looking into the padding code 44202, it is coding for laparoscopy surgical enterectomy resection of small intestine, single resection and anastomosis. So from the code language, we can understand that a resection of small intestine is performed in the CPT code 44202, while in our procedure inventory, we are having an excision of terminal ileum along with a right hemicolectomy. So that won't be our correct answer. We can eliminate 44202 and 44203, the option C right away. Now let's look into the next one, 44206. What it is coding for? It is coding for laparoscopic surgical colectomy partial with end colostomy and closure of distal segment. How many time procedure? Well, I would say this one is also a wrong one. How? Because now you can see an image which is in your left side of the screen, which is showing the procedure, which is showing what happened in option D. uh, there is a partial colectomy. Yes, that part is correct. And then you can see distal closure of the distal segment. So the distal part of after the colectomy is closed, and the proximal end, which is brought into the surface of the abdomen, and it is used to create a stoma. So this is what happening in option D, which is also known as a Harmon type procedure. Well, cross-checking with the procedure inventory, this doesn't match us with our procedure inventory. We're having a right colon hemicolectomy performed along with the terminal ileum excision, and an anastomosis is also performed in our procedure. Well, this is not this doesn't look like our procedure. That eliminates option D as well. Now remaining two options, the one which we had a split, that is option A and option B. Let's look what option A and B is coding for. 44204 is coding for colectomy partial with anastomosis, and 44205 is coding for colectomy partial with removal of terminal ileum with ileocolostomy. Well, I would say option B is the correct one, because now first, ileocolostomy, you can say the term ileocolostomy, what it is actually mean is that it's a surgical formation of an artificial opening between the ileum and the colon. So once a hemicolectomy is performed along with the excision of a terminal ileum, there is an artificial opening happening. The one end of the ileum will be open, and the one other end of the colon will be also remain open. So chorus, the surgeon who's performing the surgery after removing the colon and the excision of the ileum, they won't leave the intestine open as like that inside our body. Definitely they will be performing an anastomosis, because you know what happens if the intestine is kept open inside the body. So it is understood that an anastomosis is happening in 44205. So that brings up to the next part, that is you can see now a visual of what the procedure happened in our scenario. You can see a terminal ileum which is excised along with the colon, which is right side of the colon, right hemicolectomy. It has been performed, and then you can see there is a surgical ileocolostomy, that is a formation of surgical opening between the remaining ileum and the colon. So what the surgeon did, he did tied up, he done an anastomosis, an end-to-end anastomosis, which you can see in the second image. So this is what happened in our scenario, and I would pick option B, 44205, as correct one. And 44204 is also wrong because it doesn't completely match us with our inventory. You can see a colectomy partial which is performed. Yes, that part is correct. And an anastomosis performed. Yes, that part is also correct. But it doesn't code for one of the major procedure which is performed in our scenario, that is excision of the terminal ileum. It doesn't say, the code language doesn't say excision of the terminal ileum, while the 44205 is coding for all the three procedures which is performed, all the four procedures that is performed. So I hope that explanation helps. Do you have any questions, coders? How was this scenario? Please let us know how you feel about this scenario. Is it clear? Okay, that wasn't a bad one. How are you feeling, coders? Good? Glad to know. Okay, now let's move on. Let's move on. Yeah, some of them are feeling more confident by solving these kind of scenarios. I can see you guys are doing a fabulous job. Now let's move on and let's look into the next scenario. And I would invite this time, I think it is Miss Courtney once again. Miss Courtney, would you like to come and read the scenario for me, please?
Yeah, absolutely. All right, coders, what are the CPT and ICD-10 CM codes reported? A42145 and R06.81, B42107 and R06.81, C42140 and G47.33, D42145 and G47.33. Procedure: Uvulopalatopharyngoplasty. Indication: a 63-year-old with obstructive sleep apnea. He is intolerant of CPAP. Description of procedure: I identified the patient and he was brought to the operating room. General endotracheal anesthesia was induced without complication. Tonsillar pillars and palate were injected with 0.25% marcaine. The right tonsil was grasped with an Alice forceps and dissected from the tonsillar fossa with a combination of blunt and cautery dissection. The posterior pillar remained intact as I proceeded to do similar mobilization of the left tonsil. I then made a mucosa incision across the base of the palate approximately 0.5 centimeters from the base of the uvula, connecting the anterior tonsillar incisions. The muscular portion of the uvula and edge of the soft palate was then opened. Posterior pillar was opened inferiorly on the right tonsil fossa and extended through the palate to include the uvula, and then extended inferiorly on the left side. The uvula, edge of the soft palate, and both tonsils were removed in total. Hemostasis was achieved with electrocautery. The mucosal incision was then closed with interrupted visceral sutures. The oral cavity was irrigated with clindamycin solution. The patient was awakened, extubated, and brought safely to the recovery room. All right, coders, your time starts now.
Thank you, Miss Courtney, for flawlessly reading out those surgical terminologies. She read it very well. So coders, that's the 2.5 minutes. Okay, and now let's move on and solve the scenario. Before solving the scenario, I would like you to let know what Uvulopalatopharyngoplasty procedure is all about. It is a procedure which removes excess of tissues in the throat and make your airway wider. This sometimes can allow air to move through the throat more easily when you breathe, and reducing the severity of obstructive sleep apnea. So basically, it is removal of the excess tissue structures from the throat, and that will make the people with obstructive sleep apnea, OSA, much more easier to breathe. Okay, now let's yes, here we go. Here's anatomy of the mouth. Like you can see, there is a hard palate, there's a soft palate, there is uvula and tonsils. So while I read out through the highlighted words, you can imagine or visualize the procedure which is performed in this scenario. The procedure performed is uvulopalatopharyngoplasty, and the patient was suffering from obstructive sleep apnea, and a general endotracheal anesthesia was given, and tonsillar pillars and pellets was injected with 0.25 micron. The right tonsil was grasped and dissected from the tonsillar fossa, and mobilization of the left tonsils was also done in a similar manner. And then a mucosal incision was made across the base of the palate, connecting the anterior tonsillar incisions. Uvula edge of the soft palate was opened. The uvula edge of the soft palate and both tonsils were removed in total. So now you can see in the image, you can see the patient is not patient. We all have a right tonsils. We all have a middle portion that is a soft palate and uvula, and we have a left tonsils. So in this procedure, all the three structures were removed. So you can see those excess, if what happens, you can imagine what happens if those excess tissues are removed. It will make the airway much broader and patients can breathe much more easily. So that's what happened. And the correct answer for this scenario is option D. I saw majority of them saying option D. Okay, now let's move on to the next step, getting our procedure and diagnosis inventory. I have an uvulopalatopharyngoplasty, the procedure performed. The excision of right tonsils, left tonsils, and uvula was performed, but we won't be coding the excision of tonsils and uvula separately because that is included in the procedure uvulopalatopharyngoplasty. And the diagnosis inventory, we are having obstructive sleep apnea. So our principal procedure will be uvulopalatopharyngoplasty, and the diagnosis will be obstructive sleep apnea. Let's move on, and these are our code options. And let's start the process of elimination. Let's look into the option B42107. It would be wrong answer because that is coding for excision of lesion of palate uvula with the local flap closure. Cross-checking with the procedure inventory, it's not a lesion which has a lesion of palate or uvula which has been excised. It's uvulopalatopharyngoplasty is the procedure. So that is wrong one. And now let's look into the next one, option C, that is coding for 42140G47.3, which is ovulectomy, excision of uvula. Once again, excision of uvula was performed, but it was not just uvula excision alone performed in our scenario. We had excision of tonsil and a portion of soft palate as well. So that will also eliminate option C. Remaining two options are option A and D, and only thing which differs between them is ICD. Let's look in the CPT portion 42145, which is coding for palatopharyngoplasty, and that is the correct CPT. And you can also see the procedure terminology mentioned in the brackets over the uvulopalatopharyngoplasty. Yes, that is the procedure which is performed. And now let's look into the ICD. We are having two ICD. Option A is coding for R06.81, which is apnea unspecified, while the option D has the ICD of G47.33, which is obstructive sleep apnea, adult or pediatric. And what is the diagnosis inventory we are having? You can see it's obstructive sleep apnea. Patient was suffering from obstructive sleep apnea, which is a more specific term. And the correct answer will be option D. How are you feeling about that scenario, coders? I know you didn't took how much time to solve this one. Okay, that's the time. And Mrs. J, do we have time to pull out one more scenario?
Hi, coders. This is Miss Eva. Mr. Sandeep, if we only have one more scenario, coders, so would you like for Mr. Sandeep to do the last
Yes,
scenario, or would you rather? Okay,
yes,
they're
coaches. We are
saying
having
yes.
just a small scenario. Would you like to do
Okay,
that one? Okay,
yeah,
I
go
think
ahead,
most of
Mr.
them.
Sandeep.
Okay, okay, coders. Next one, I would take a male genitourinary system and
I think
Miss
this
Good.
one's mine, Mr.
Yes,
Sandy.
please,
Thank you.
please.
Thank you so much. Voters, you guys are doing great. Last one. Okay, what are the CPT and ICD-10 CM codes are reported? A, 54150 Z41.2. B, 54150 modifier 52 Z41.2. C, 54160 modifier 52 Z41.2. And D, 54161 Z41.2. Operative note: preoperative diagnosis, desire for circumcision. Postoperative diagnosis, desire for circumcision. Procedure, circumcision. Anesthesia, general. Indications: the patient is a 19-year-old white male, sexually active for 2 years. He requests circumcision. He understands the risks and benefits of circumcision. Prescription description: the patient was brought to the operating room and placed in the operating room table in the supine position. After adequate LMA anesthesia was accomplished, he was given a dorsal penile block and a modified ring block with 0.25% marking plane. 2 circumferential incisions were made around the patient's penis to allow for a maximum anesthetic result. Adequate hemostasis was then achieved with Bovie, and the skin edges were reapproximated using 4-0 chromatic simple. Interrupted sutures with the U-stitch at the frenulum. The patient was extubated and taken into the recovery room in good condition. Disposition: the patient was taken to the post-anesthesia care unit and then discharged home. What are the CPT codes and ICD-10 codes are reported? Coders, you have a minute and a half. You may begin. All right, coders, get your answers in. That one was a little tricky. Mr. Sandeep,
Thank you, Miss Josie.
Perfect. Thank you.
Yes, yes, that one also took me because I see a lot of mixed answers in the scenarios. Coders always try to be forensic about the small details which we have in these operative scenarios. Okay, let's move on and let's get this done. So the key highlighting the keywords: post-operative diagnosis. We have a desire for circumcision, and the procedure was circumcision. The patient was placed in a supine position and a dorsal penile block, and a modified ring block was given with a 0.25 Macan plane, and two circumferential incisions were made. Skin edges were reapproximated, and the sutures with a U stitch at frenulum was done. And the correct answer for this one is option D, and only few have said option D. Let's move on and solve the scenario. The procedure inventory, we are having a circumcision. What else happened here? A dorsal penile ring block was given, and a modified ring block was also given. In the diagnosis inventory, we are having a desire for circumcision. Okay, now we are having three codes for this scenario, and let's look what for 54140 code is coding for. It states a circumcision using clamp and other device. It's very important. These were the details which I was mentioning previously. So this is for a circumcision using the clamp or other device, though it is also using with a regional dorsal penile or ring block, but this is mainly for the one which is using the clamp or other device. Did the surgeon in our scenario use any device? I would say no. No clamp or no device were used. It was a surgical excision. So that will eliminate all the options which is having the CPT code 54150. That will be option A and option B. Now the remaining two options are option C and D. Now, I would say the option C is wrong, because once again, if you read the code, code language, it is stating that circumcision 45160 is coding for circumcision, surgical excision other than clamp. That portion is correct. Let's read out. Let's go ahead and read the remaining portion: other than clamp, device, or dorsal slit, neonate. That is an important part in this code. Neonates 28 age or less, and in our scenario the age of the patient is 19 and he is not a neonate, so that will eliminate option C, and the correct one is option D: circumcision, surgical excision other than clamp, device, or dorsal slit, older than 28 days of age. So coders, how was that? How was that? Now, was that an aha moment? I think it would be. Do you have any quick questions on this scenario? Because I know it's time and it's time to close. Do you have? Yes, it's aha moment. Do you have any questions, coders? Quickly. Quick questions on this one. Is it clear? Is it good? Okay. Okay, thank you. So always, coders, take a look into these small details and the key terms, and you will be all fine. So the answer is D. And thank you, coders, for attending week 2. And we will see you next week. And have a nice day ahead. I mean, it's a night over there. I'm sorry, it's morning here. That's why I said. So a good night, coders. See you next week.
Thank you, coders. That will be it for today. Miss Josie, you guys did wonderful in the chat. It was great participation. Miss Josie, would you like to say goodbye to the coders?
Yes, Miss Eva, and yes, coders, you guys did awesome. I know a couple of them were a little tricky, but you guys even worked through those. Congratulations, you did a great job tonight. Thank you, Mr. Sandeep. Good night, everyone.
Good night, everybody. See you guys next week.